Well, it's early in the legislative session, but some bills are already gaining traction. Let's review bills making their way through the Statehouse. A bill that would allow counties or municipalities to establish a needle exchange program without getting state approval first is headed to the House floor. The state's new Attorney General testified against the proposal, saying expanding the programs would have a detrimental impact on both public health and safety. The State Health Commissioner and the State Director of Drug Prevention, Treatment, and Enforcement say relaxing the requirements is a much-needed step to reduce the spread of HIV and hepatitis C. This session's major road funding bill cleared was approved by the House Roads Committee. The bill includes fuel tax increases and new vehicle registration fees. A fiscally conservative group called Americans for Prosperity Indiana opposed the fuel tax. The group proposes shifting all sales tax on gasoline to pay for roads and freezing all other state spending. GOP Senator Luke Henley is not a fan.
Indiana cannot afford not to do this and do it right because our economy depends on good roads.
The town hall was organized by Americans for Prosperity Indiana, a fiscally conservative group that strongly opposes the fuel tax increases in the House GOP road funding plan. AFP Indiana will hold other town halls around the state on the issue. An amendment to a bill governing short-term rentals like Airbnb would prevent short-term rentals from operating year-round, capping them at 180 days. The original proposal would have prevented local governments from being able to prohibit or regulate short-term rentals except for when it comes to public health and safety. City officials from East Chicago, Indiana, requested state aid from the General Assembly to combat their lead contamination crisis. The mayor says multiple state and federal agencies have denied requests for more money to clean up the city's Calumet neighborhood. The delegation testified in favor of two bills before the Senate Appropriations Committee. One bill seeks aid for the East Chicago School District. The other seeks $5 million over 2 years from the state. A bill designed to significantly reduce the restrictions on e-liquid manufacturers in Indiana had its first hearing in a Senate committee. Under current law, 7 producers control the Indiana market. The restrictions went into effect last year. They prompted a lawsuit from e-liquid manufacturers and sparked an FBI investigation into whether some lawmakers benefited financially from the legislation. All Indiana teachers would have to undergo a criminal background check every 5 years under a legislative proposal gaining momentum at the Statehouse. The House Education Committee unanimously approved a bill that tightens policies on background checks. A Senate committee approved a bill that would require online retailers to collect sales tax for Indiana, even if they have no physical connection to the state. The bill would require online retailers to collect sales tax if they meet a certain quantity of sales. Now, there are questions about the legislation's constitutionality, and a federal court will have to weigh in before Indiana can start enforcing the bill. Some Indiana legislators want Hoosiers to be able to get a glasses or contacts prescription online. As Barbara Brozier reports, a telemedicine bill passed last year prohibits the practice.
Several lawmakers are backing a bill that would remove the restrictions on prescribing vision devices through telemedicine. They say the bill is about increasing access for Hoosiers.
Well, we all know that we have an access to health care services problem in Indiana. So in some parts, finding a health care provider is difficult in rural areas.
Opternative is a service that offers online vision screenings. It allows people to get a glasses or contacts prescription after completing a series of tests using a computer and smartphone. But many optometrists oppose the bill that would make services like Opternative legal.
As somebody who's practiced for over 25 years now, taking care of tens of thousands of patients, I think of patient after patient after patient that have sat in the chair thinking all they wanted was a pair of glasses or to renew their contact lens prescription, and we find something very significant and deal with it.
Sutton says optometrists can detect diabetes, high blood pressure, and even tumors during routine exams. Opternative offers its services in 39 states, but pulled out of some, including Indiana, because of legislation. For Indiana News Desk, I'm Barbara Brozier.
South Carolina passed a law banning Alternative from providing prescriptions in the state last year. Now Alternative is suing. We'll continue following these and other bills as the session progresses.